Good evening, everyone. My name is Nandini Chandrasekaran. This is Molly Viscardi and Meghan O'Brien. Thank you all so much for being here. We are Remind. We're a recently formed nonprofit dedicated to bridging the gaps in behavioral health care. And tonight what we're asking for is $49,000 in grants to help us grow and expand our business. So here's the problem. In Philadelphia, over 9,000 are discharged from inpatient psychiatric care annually. Ideally, to ensure continuity of care for these patients, a discharge planner would schedule an appointment for them before they leave the hospital to connect them with an outpatient provider. The patient would then attend their first appointment, receive the care that they need, and move forward with their lives. Unfortunately, what we've seen is that outpatient providers don't take responsibility for these patients until they attend that first appointment. And so a lot of patients will fall through the cracks during this period of transition. Nationally, 42% of those discharged from inpatient psychiatric care miss that first appointment. And those patients are 2 to 3 times more likely to endure costly and distressing rehospitalizations. This costs a city like Philadelphia almost $9.5 million annually. One of the main reasons why patients miss their appointment is simple. They forget. The impact of all of these missed appointments, on the other hand, is complex and affects a lot of different people. Patients with behavioral health needs face an increased risk of unemployment, homelessness, and other threats to their health. Hospitals, as we move increasingly towards a pay-for-performance model, are penalized when patients are readmitted. Outpatient doctors at clinics face increased wait times and loss of revenue. And then ultimately, all of these missed appointments and rehospitalizations places added pressure on already scarce community resources and emergency services. So to address this problem of no-shows, missed appointments, and the compromised care that results, we assembled an interdisciplinary team of Penn students from the schools of medicine, nursing, social work, and our fourth teammate is graduated from the School of Government Policy. We brought our idea for an intervention to the National Public Policy Challenge last year and won first prize. And since then, we've been investing our winnings into developing Remind, which is an automated appointment reminder service which generates text message reminders to help patients get to their first appointment. We asked discharge planners to collect 5 points of information and enter them into a secure web form, and then that data is used to generate 2 text message reminders that go to the patient at 2 and 7 days prior to their appointment. We can also send them Google Maps and transit directions as recommended by the focus groups that we conducted with patients. And ultimately, the data from our website can be linked with claims information in order to evaluate our service and also to inform future, more targeted interventions. So since attending that first appointment is such a critical step to ensuring care continuity, what we're proposing with this reminder service is essentially a bridge between these 2 points of care. We've been successful in partnering with Community Behavioral Health, which is the nation's largest behavioral health managed care organization. They provide coverage for 460,000 Philadelphians who receive Medicaid benefits. And we are working with them to implement Remind at 14 inpatient hospitals with a pilot project set to begin this summer. What we offer to CBH and to our future clients is not just the appointment reminders, but a package of services, including engaging stakeholders in the hospitals, clinics, and community, developing a customized website, training and supporting their staff so that they can fluidly implement this reminder into their practice, and also monitoring and evaluating the service for continuous improvement. Following the launch with CBH, we will move into a phase of data collection and use that data to refine our product and then hopefully expand both vertically and horizontally in the Pennsylvania and Northeast regions. So at the beginning, when I said that what we would be asking for is $49,000 in grants to grow and expand our business, what that would be going towards is continued development of our HIPAA secure website, funding a part-time staff person who would be focused on training and building our client base, expanding our marketing efforts, and other program costs that we've detailed in our business plans, which you should all have. We anticipate in the first 2 years our costs will be higher as we focus on refining and building this product and expanding our client base, but that by year 3 we would have 6 clients who would all be paying for the reminder service and the consulting package that would allow us to break even, and then moving into our 4th year have a small surplus that we can then reinvest into making our program sustainable. In conclusion, why Remind? We offer a simple and patient-friendly intervention that uses an existing, accessible, and cost-efficient technology that has been proven to be effective with this population. We can fill an important data gap, improve care continuity, and reduce inefficiencies in the hospital-to-clinic behavioral health pipeline. So you can visit www.remindphilly.org if you'd like to learn more about us. But we thank you so much for your time and attention today and look forward to speaking with you further.